Hello, everyone, and welcome. We're very excited to welcome you today to a new webinar with Dr. Monica Boen. You can see on your screen here, we today are going to be talking about refreshing your glow. Dr. Bowen's tips for busy moms and anyone on the go, which I don't know, I think is pretty much all of us nowadays. So I think this is a great webinar for all of us. So thank you so much, Dr. Boen, for putting this together. I will just give a few minutes for everyone to get situated because we had a lot of people sign up today. But as you heard when you joined, this is being recorded. So if you miss anything, don't worry, we'll send you the recording and you can always forward, the YouTube links to friends or family if you think it would help them. We also are live. It's Tuesday, April 22nd here and 5:32 p.m. here in San Diego. So after Dr. Boen finishes the presentation, we will have time for Q&A. So there's a little button down here for questions, Q&A. You can feel free to pop any questions in at any time, and we'll try and get through as many as we can. And make sure to stay tuned until the end, where we will talk about the promotion for a few lucky people that are joining this webinar. Otherwise, I think that we're almost ready to get going. So here we go. Welcome everyone to a brand new webinar with Cosmetic Laser Dermatology. Today, I'm excited to be here with Dr. Monica Boen, a board certified dermatologist, and she is going to be telling us all how to refresh our glow. So it's Dr. Bowen's tips for busy moms and anyone on the go. So I think that this is a very unique webinar because I think it will touch on so many of all of our concerns. But, Dr. Boen uniquely understands the on-the-go issue. She is a full-time practicing board-certified dermatologist and a mom of two little toddlers herself. So she definitely understands, pregnancy-related changes, needing to do things without too much downtime, how to get treatments in with your busy lifestyle. And so I am excited to hear all of her tips because I think we could all use some support. Without further ado, I am excited to introduce Dr. Boen. So as I mentioned, she's a board certified dermatologist and she has been with Cosmetic Laser Dermatology for a number of years now. How many years is it, Dr. Boen?
7 years.
7 years, amazing.
Yeah.
So Dr. Boen treats all sorts of injectables, lasers, body sculpting, vein treatments. Today, she's going to be focusing on a select few of them. And just as a reminder, we do have 8 board-certified dermatologists in our practice, and all of them are able to do most of the procedures that will be spoken about today. So, Dr. Boen, thank you so much for taking the time to educate us today, and the floor is yours.
Great. Well, thank you all for attending the webinar. And do not worry, this will be recorded later so you can watch as well. So the goal of this webinar is to help you refresh your glow and your skin for everyone on the go. Okay. So glowing clear skin is something that will never go out of style. Now there's a lot of trends on Instagram and TikTok for different beauty aspects, but clear skin was in the 1950s. It's still currently in, and it was even in during the Renaissance with this painting by Leonardo da Vinci. And why is glowy clear skin in? This is actually a marker of health. So a lot of internal things can manifest in the skin. So people with glowy, healthy skin have the appearance of being more healthier. And this is why it will never go out of style. And so now there's a trend, speaking of trends, on TikTok and Instagram of this glass skin. So this actually came from a Korean or K-beauty trend that emphasizes skin hydration, proper cleansing, and skin barrier protection, something that we have been a proponent of in dermatology for decades. And so I define glass skin as a dermatologist as skin that is hydrated, smooth and untextured, and an even tone, and we are able to get glass-like skin for patients. Of course, we can't sometimes have you have the Hailey Bieber glow or have a 20-year-old skin, but we can get the best skin quality and health for you. And now I think patients understand that there is an emphasis on skin quality, and a lot of our in-office treatments will help you achieve that. So my aging philosophy is to suspend you in time. I don't want to make you look unnatural or not like yourself. I want to enhance your own beauty. Everyone has their own unique aspects about them. And so that is my goal, to keep it natural, but to maintain. We want to age gracefully. And so these are just some central tenets that I propose to patients to help them maintain their skin. So first is skincare. I have a tailored skincare regimen depending on what type of skin you have: oily, dry, redness prone, acne prone. And of course, I make sure to incorporate UV protection daily with hats and protective clothing and a sunscreen that works for you. Next, it's important to maintain collagen and elastin production. Unfortunately, with the aging process, we lose a lot of that aging or elastin and plumpness and lines. And so there are in-office treatments now that can help you boost that collagen and elastin production. And since we live in San Diego, third tenet is to diminish and prevent hyperpigmentation. A lot of the UV damage causes our melanocytes to overproduces melanin, and it gets distributed within the epidermis and dermis. And so my goal is to have an even tone of the skin with skincare and in-office procedures. And lastly, sometimes skin health can be maintained by managing medical skin conditions, whether acne, melasma, or rosacea. And as a board certified dermatologist, I can diagnose medical skin conditions. A lot of patients are coming in for one thing, however, they end up having eczema or rosacea. And I also find skin cancers a lot in my patients as well. And so up to the first tenet. So number one is protecting your skin from the sun. And why is this? Photoaging is responsible for up to 80 to 90% of visible extrinsic skin aging. Now that is huge. If you are able to protect your skin with sunscreen or sun protective methods, this is a huge help for your skin. Because chronic ultraviolet radiation or sun exposure can cause oxidative stress, causing DNA damage and breakdown of the skin structure. And UV exposure degrades collagen and elastin fibers in our skin, and we need those. Sun protection is key here. Of course, putting sunscreen on a toddler is like wrestling a grater, so good luck with that. And this is just a sample of an easy skincare regimen. Very easy, vitamin C serum. I like the elastin. I have other suggestions too. Moisturizer to get you that hydrated glass skin, a sunscreen, and then at night, it's important to cleanse the skin. If you are a makeup user, um, it is important to wipe all that makeup up. Makeup and other dirt that gets on the skin is very pro-inflammatory, and any inflammation in the skin can lead to redness or pigmentation. So that's why cleansing is very important, especially at night. And this another simple routine is to use a retinol or other serums, TNS essential serum, elastin illuminate, and a moisturizer. So we can simplify your skincare regimen to make it very simple and not too complicated. And now this is a very disheartening slide. So did you know that collagen and elastin production decline as early as age 25? So unfortunately, by the time you're 40, 25% of collagen is gone. You lose about 1% a year. And by age 50, there can be up to a 30% collagen loss. And so we have many in-office treatments to help maybe slow down that curve a little bit. And of course, to piggyback, whenever we talk about collagen, I always get asked this question, so I will get ahead of it. Do collagen supplements work? And so a lot of the collagen supplements over the counter, they come from various sources, fish, chicken, um, and other sources. And it is basically collagen that is broken down as a component peptides for better absorption. There have been several studies and examining whether collagen is good for the skin. And in 2021 meta-analysis of 19 studies, it showed that collagen supplementation could improve skin hydration, elasticity, and wrinkles. However, with these studies, there were a lot of confounders and a lot of other things that may influence results, and they are usually short studies too. So I cannot fully recommend collagen supplements because there are no large-scale clinical trials to prove their efficacy. However, they seem to be safe. And if you'd like to take a collagen supplement with your coffee or in the morning, that is totally fine. I just am not sure if there is rigorous evidence behind this. So for skin hyperpigmentation, which is a big issue in San Diego. So what causes this? So melanin is the primary pigment that we're targeting in the skin, and it is produced by cells called melanocytes, which make up actually 10% of this basal layer of the skin. And so things that irritate the melanocytes, such as inflammation, UV exposure, and other irritants, can cause melanocytes to increase their melanin production. And then the melanin can go throughout the epidermis and dermis, causing this hyperpigmentation and uneven tone of the skin. And so there are ways we can do to prevent this that I will discuss later. And then the question I get asked a lot too is pores. So are enlarged pores related to collagen loss? And they actually are. With the aging process, due to less collagen and elastin support around that pore, pores can appear bigger. However, pore size is largely determined by genetics, such as excessive oil production or some acne can increase the appearance of the scar of the pores, and sun exposure as well. Breaking down collagen and elastin can cause the pores to appear more prominent. But don't worry, as cited here in one of these articles and other articles, there are treatments that can address this. We cannot make the pores disappear, I wish, but we can diminish their appearance. And once again, pores are actually different from sebaceous filaments, which has gotten a lot of traction too on social media. So sebaceous filaments are actually just part of the normal pore. It's basically oil and dead skin in the pore. Everyone has these sebaceous filaments. They're a normal part of skin function. However, some people are more prone to have visible sebaceous filaments due to increased oil production or slower skin turnover. And there are some skincare tips I will discuss later to help with pores and also sebaceous filaments. So now let's move on to patient cases. So this is one of my patients, and I do love the examples of before and 1 year later. So this is actually after a whole year of treatments. And so this patient was concerned with just some fine lines, very fine, hyperpigmentation, acne, some acne scarring, some redness, and then also, she wanted a little more radiant skin. And as you can see after these treatments, her skin looks more glowy. The pores seem to be diminished in size because there's more collagen production. And I'll go through what we did for her. And she's not wearing any makeup, and no fillers were used. So this patient had acne, postnatal erythema, fine lines, hyperpigmentation. So number one, we had a tailored skincare regimen. Very light Botox was used in the upper and lower face to soften dynamic lines. And sometimes the lower platysmal muscle pulls down the face as well. So by relaxing that platysmal muscle in the lower face, you can have a little bit of a lift. Photodynamic therapy was used to treat active acne and reduce inflammation. And photodynamic therapy is something actually we developed at Cosmetically Rheumatology. This is a non-oral method to treat acne. Multiple treatments are needed, and it is actually undergoing FDA trials for official approval as well, but is a very good treatment for acne along with our Cure laser. We did V-beam to target redness, intense pulse light for tone and texture, and then one of my favorite, the clear and brilliant lasers to refine skin texture and boost radiance. And most of these, other than maybe the photodynamic therapy, are very low downtime. They can all be performed on the same day. So even though this is a lot of things, all of these things can be performed on the same day. Maybe you see me 2 to 3 times a year for these treatments. So they can really be incorporated for your on-the-go lifestyle and help fit in your schedule. And now, speaking of pores, this patient had some acne scars, some redness from acne, and some increased pores because of the excessive fluid production and acne. And as you can see after the treatments, the pores are less visible because probably some collagen was boosted. Those indented scars are a little bit less. And the skin has a luminescence to it. It has a glow after these treatments. And that's because when you get rid of some of the reds and the indentations and the texture, this makes a huge difference. And so here, of course, we did a treatment regimen for acne because as board certified dermatologists, we always treat medical skin conditions first, a series of V-beam lasers for redness, and then a Fraxel Restore laser for indented scars and pores. She actually only had one Restore laser and she responded very well. And now some tips to improve pores with skincare. So good pore health, you definitely should cleanse daily. Always remove makeup, that is pro-inflammatory. 1 or 2 times a week if you can. I like to use an acid-based cleanser such as salicylic acid or glycolic for a deeper clean to kind of clean out the pores. And then topical retinoids or tretinoin, they improve skin turnover and refine texture. So if you have more skin turnover, you're able to get those dead skin cells out. And then I do like serums that can also enhance some collagen production, like vitamin C, peptides. Exosomes are very big, but that's a whole different lecture. Or if you want, I can do an Instagram on that and about growth factors, which are in. We can always do a separate Instagram reel about that to enhance skin luminosity. Also, studies have shown that actually Botox can give your skin a glow. And if you've had Botox or Dysport, Jeuveau, Daxxify, you've probably noticed that in the areas that we inject Botox, the skin looks glowier because actually this can minimize pores and increase skin radiance. And interestingly, it does this by paralyzing the erecti pili muscles that contribute to sebum production. So if you have less sebum production, the skin looks more glowy. And you also can have improvement in scars. So we also use Botox along with our laser treatments to minimize the appearance of scars. In scars, there's a lot of tension in the wound, and Botox itself may actually help with the scar process. And so this is a patient who underwent several treatments after a traumatic surgical scar, scar that was then had surgery. And as you can see with early intervention and this combination approach, we're able to improve her scar. And more about scars. And so when patients have acne scars, they usually have redness and this indentation along with other things. And this can cause an uneven skin tone and texture. And so by improving the scars, you are actually also giving that skin more luminosity, more glow by reducing that shadow reflex. As you can see here, we have a nice improvement in these very deep acne scars. So here, this is a little bit more downtime, but I really do love treating acne scars, so I want to include it. I did a V-beam laser for redness, and then this is our laser resurfacing with a CO2 and erbium lasers with subcision. For acne scars, if it's just a smaller area, this is an easier downtime for patients, but sometimes we do have to use the big gun lasers to really help with those deep acne scars. And next for hyperpigmentation. And so in San Diego, with the excessive sun or in other patients who aren't in sunny climates, there's overproduction of melanin in the skin. And so we use topical skin brighteners that affect that melanin pathway, inhibiting some of the enzymes like tyrosinase with hydroquinone or other skin brighteners, but also in-office laser treatments are very important along with sunscreen. And so this patient had melasma. And as you can see, she has melasma because of this irregular pigmentation. But it's important to note, I always tell my melasma patients, patients with melasma also have a component of photo damage. So we are usually treating both. Melasma, of course, is harder to treat because it can recur. And so for her, we had a tailored skincare regimen for hyperpigmentation, a V-beam for a little redness. Usually for my melasma patients, there also is a little redness. And oh, sorry, we did a clear and brilliant laser for her melasma. And so glowing skin takes consistency. So this is very important. To achieve the glowing skin, it takes multiple treatments, it takes time. And this means that you have to, be dedicated to the treatments. It doesn't necessarily a lot of downtime, but like all things in life, consistency is key. And a lot of my patients, they've done the laser and at first they don't see a lot because it's been 2 weeks or 3 weeks, but then, a month, 3 months later is really when everything comes together. And so since a lot of these procedures are lower downtime, they do take multiple treatments to get the results you need. However, doing this for several years, I know I truly know and believe in the power of these treatments for patients. And so this patient wanted just a little refresh for the lines, pigmentation, a little luminosity, and so we did a combination approach for her, a little bit of fillers and lasers. And so you can notice, like, the skin looks more glowy. There's less fine lines because we did some Botox. And then the jawline looks a little sharper from a little jawline filler. The cheeks are a little bit more because of light Sculptra. And they're all like very light tweakments that you still look like yourself, but just a little more refreshed. And for this patient, we did a few different things. So this may seem like a lot of things, but once again, a lot of it can be done in the same day, or in multiple visits, depending on a patient's comfort level. We did some Sculptra, which I love. This is a biostimulatory filler that needs its own webinar, and we have used this a lot. This is actually not a traditional filler. This is stimulating collagen, and so I do like to recommend Sculptra a lot, and you don't see the effects for multiple weeks, but this is not a filler that stays in the skin. It just dissolves and then you build some collagen. We also did a few hyaluronic acid fillers to enhance the jawline, upper and lower facial Botox, some intense pulse light V-beam lasers, clear and brilliant, and also a Potenza radiofrequency microneedling for some skin tightening on the neck, which I like. And then one of my favorite procedures, though I will say this is a little bit more downtime. So this is maybe you reserve this for when you have 5 days of just light where you can have some crusting. And so this patient is 6 weeks post the Fraxel Restore Dual with Alex and V-Beam. And you can notice the skin looks already brighter and the fine lines look less, even around the mouth. We didn't do an ablative laser. This is all non-fractional. But she looks much brighter after this. And so for her, we did these lasers all on the same day: V-Beam, Q-Switch Alex, Fraxel Restore, Fraxel Dual. And then even though this is a really nice result after one treatment, we may have to repeat this in 6 months or a year, depending on how much more skin quality improvement the patients want. And this is really a stellar laser that has very nice, consistent results for patients. It has maybe a light 5 to 7 day downtime, but really, really nice results. Especially combined with the V-beam, you notice the redness is much less, the sunspots are much less, and just clearing the reds, the browns, and boosting that collagen just makes a huge difference. And you still look like yourself, which is our goal. I want you to look natural and like yourself, just maybe the best version of yourself, just with the best skin. And a lot of our patients do not want to wear makeup. And so for this patient, after this laser, you don't need to wear makeup, and that's the goal. And so now about the downtime. So if we want to start with a low downtime laser, there's a few I'll recommend. These are just, we have, 40 to 50 lasers at our clinic. But if you want a very low downtime, Tense pulse light laser, clear and brilliant laser, mild to moderate downtime of some crusting are radio frequency microneedling, Q-Switch Alex, picosecond lasers, Fraxel, Restore Dual, and photodynamic therapy. And so these are mild to moderate. Some patients only 2 to 3 days downtime, but it really depends. And so, glowing, healthy skin is possible. It just takes time and consistency. And my goal for patients is to work with your skin, create a customized skincare regimen, offer in office treatments to improve and maintain skin tone and texture by stimulating collagen and elastin production, addressing hyperpigmentation and also redness, and also treating medical skin conditions. And so, this glass-like glowy skin is possible. Um, it just takes time and consistency. And putting it all together, these combination treatments, that is my goal for patients. And these are the two that age me and why I need all my laser and in-office injectable treatments. I have a 1.5 and a 4.5-year-old. And as you can see, they're very pale. So I'm also make sure they have a lot of sunscreen, but it's really hard to wrestle the little one. All right. So
Right.
now, yeah.
Amazing. Thank you so much, Dr. Bowen. That was so great. Such a great overview. So I'm going to remove your screen so we can see you a little bit better. And guys, this is the time. You have Dr. Bowen here at your disposal to ask any questions about anything she commented about or just how any of us can have nice glowy skin. So here is the first question. Um, does red light therapy help with keeping skin to look younger?
Yeah, so I get that question asked a lot for red light. I think it's fine. It won't be as strong as our in-office laser treatments, and it takes like more time and consistency because you have to do this like every day. And so I think it's fine. It can make like sometimes melasma worse. S- and so I'm totally fine with patients using it. It just sometimes it won't be as strong as some of our in-office laser procedures.
Got it. All right. Here's another good question. So I always wear sunscreen, but every once in a while I still get a small sunburn. Is there anything I can do to prevent the sun damage from occurring after I get a
Yeah,
sunburn?
so with, sunscreen is actually really hard to put on, and this has been studied. It's even, it's really hard to put on the right amount, and then some of it will wash off or you'll sweat it off. And so it's definitely not perfect. And then it's hard to put like a thick enough layer on and to reapply. And so it's very actually tough to do sunscreen correctly, even for dermatologists. And so my tips are, the peak sun, like when you look at your phone, you look at the UV index, like from 10 to 4, and it's super high. You can have sunscreen, but that sunscreen may not protect you fully. You may have to like cover up or seek shade. The best thing, is just to live in a cave and avoid the sun. But yeah, sunscreen is absolutely not perfect. If you are having like a very sunny day, you're in the sun a lot, make sure to reapply every 2 hours. If you're in the water, have a waterproof sunscreen. The SPF 50s or even 100, 100 has been shown to have more efficacy to prevent sunburn than 50, but it is thicker. So these are just some tips. But yeah, these are not perfect.
And what if someone does get a little bit of a sunburn? Is there anything they can do to prevent the sun damage from occurring from that specific sunburn?
So, unfortunately, when the sunburn when it's done, unfortunately that damage is done. But, like the Fraxel dual laser has been shown to prevent skin cancers by half, and phonemic therapy does treat photo damage. So we can do some erasing in office once the sunburn has cleared.
Ah, okay. Um, all right. Is it better to use vitamin C on the skin in the morning or the evening?
Oh, that's a really good question. So it is you can use it twice a day, that's no problem, but it is better to use it in the morning because you get antioxidant protection. It helps your skin fight reactive oxidant species and oxidative damage from the sun. So it actually enhances your sunscreen.
Mm. Um, all right. How about if my weight is changing, should I put anything on my skin to prevent getting stretch marks?
Yeah, so a lot now too, we deal with a lot of like weight loss and skin, especially with the Ozempic and GLP agonists. And so there is nothing, unfortunately, to prevent stretch marks, but keeping moisturized with a ceramide based moisturizer, I do like the Skin Cuticles triple lipid ointment, and there are actually now other skin formulations. Elastin has actually a body cream. Skinmatic has a body cream to address that creepiness and perhaps add some like peptides to prevent stretch marks. So those are possible. Like I would say, try to use the peptides, and these are actually formulated for the body because a lot of patients are on this weight loss journey. So you can always use those, but it's not perfect.
Got it. Um, are spray sunscreens okay to use on our kids? I know people say not to, but they're so much easier.
Yeah, I know. I think it's fine. I think it's just like the air isolation that people worry about. But I think you can miss. There's like some study that show you can miss some spots with the kids. So as long as they don't inhale it, I think it's fine. It's hard. The makeup brush works too, but sometimes spraying them down is helpful.
That's a good idea. That's a good idea. Um, all right. Someone's raised their hand. Can you pop your question in the chat or the Q&A if possible, so we can hear what your question is? Um, what are your thoughts on how often to kind of get chemical peels and esthetician treatments in combination with the lasers and injectables?
Yeah, I think it's really helpful to the hydrofacials or chemical peels and other facials it's I like to do it depending on the laser. Some I will do it before a big laser because then a lot of the dead cells are actually off of the skin and the laser can technically penetrate better. So for some, especially for PDT, or if we, have a bigger laser, I do recommend you can do a facial before and then after our bigger lasers, 2 months after a facial can be good to rehydrate the skin as well and to like maintain that glow.
Hmm. All right. Um, what about infrared red masks?
Oh, yes, yes. I think the red masks are, I think they're fine. So the infrared is like a little, so the red light is the visible and infrared is another wavelength that's more like heat based. The problem, there's not like a lot of studies with a lot of the masks, and there's so many different masks. So I always get like asked on brand names. I think it's totally fine. It takes commitment. And it just won't address like one laser won't address all your issues. So it won't address necessarily all the skin aging issues.
Hmm. All right. Um, here's another question. Do retinol body lotions work? Versed brand. I don't know.
Oh, yes, I do think they do slightly work. So there are um retinol lotions for like we use them for crepey skin, especially like in the inner arms. Um I do like to use those, especially with our skin tightening treatments and also our like peptide based uh, topical formulations with elastin or Skin Medica. Yeah, now those are the two main ones that are these medical grade body creams to help with like crepey skin or post weight loss. And we do them a lot in combination with like our Thermage, Ulthera, or soft wave treatments as well, like when we're doing neck, chest, or inner arms. Um, Especially that inner arm creepiness, which we treat a lot. So those will enhance your results as well.
Got it. And you guys, some of the skincare that Dr. Bowen's talking about, we actually have a promotion going on through the end of April for the elastin, the one that she just talked about, and she mentioned SkinCeuticals triple lipid, and we have a promotion
It's a
going
good
on for
one.
SkinCeuticals as well. All right. So I think that there are chemicals like titanium that make my eyes smart. If I cover with face powder, would that interfere with the efficacy of the SPF?
Oh, so you can after you put sunscreen on, you can absolutely put makeup on if you have like a tinted foundation. That tint actually will help protect as well. But you can absolutely use usually the sunscreen first, and then you can put makeup over your sunscreen.
Got it. And then how do you reapply sunscreen if you put makeup on over it?
I know yeah, sometimes you use like a tinted one or that's a tricky one to reapply. Except you can use the brush too, but the brushes are not as effective. But yeah, as
Oh,
the cream-based sunscreens.
got it. Okay. Um, While oh, here's a good one. Oh, this is a tough one. Dysport versus Botox. What do you recommend?
Yeah, no, and
From an anonymous attendee.
so I use all of the neuromodulators. Uh, I like to sometimes recommend Dysport for patients who have a broader forehead or more diffuse muscles. It'll spread more. I like to use Botox for the lower face. However, I use all of them. And so, but I will make suggestions for patients where I think Dysport or Botox or the newer one, Daxify, may work better for you. And so there are like subtle differences depending on your anatomy between the neuromodulators.
Got it. And if you're considering getting one of these neuromodulators, I will say in the month of May, we have some good promotions from Ally, which is the like
Mhm.
the loyalty program that Allergan makes, the makers of Botox. And they have some great promotions coming up in May that you can use towards buying gift certificates to use for Botox. All right, let's see. And do we have any more questions, guys? I think I'll ask one myself while we're waiting. So it's Rosacea Awareness Month right now. It's
Mhm.
April.
Mhm.
What are your favorite tricks and treatments for rosacea?
Yeah, rosacea is actually a huge quality of life issue for patients because of the flushing, because of this like redness, and pa patients say that people ask them like what's wrong with their face because of their rosacea. And so, of course, we manage with medical, topical, and oral options, but some actually of the gold standard treatments for the redness of rosacea can only be treated by lasers. So topicals don't really address redness; they can address it mildly. However, the lasers specifically target redness. And I'm talking about V-beam, intense pulse light, and other energy-based devices. And so these are very key. They treat the redness. They're actually also anti-inflammatory. So a lot of patients' rosacea will improve with this conjunctive laser treatment.
Got it. All right. So any final words or thoughts that you want to get in before we wrap
Yeah,
up
no,
here?
I mean, I love kind of guiding patients to improve their skin quality, volume issues, skin sagging. And I love seeing my patients over time, just kind of maintaining it. My favorite is when like 5 years later, a patient's told me, I look better or younger than I did when I started. And so that kind of really makes me happy. And each patient is a puzzle. I try to make the treatments tailored to them, whether, downtime is a big factor, time of treatments, if it's something they want fast. We also offer topical numbing. We make the treatments very comfortable. So pain is like a big question. Try to make the treatments as comfortable as possible. Our staff is very knowledgeable with aftercare, and we call you the day after, 2 weeks after. If you have any questions, we answer them right away. So we are, oriented to serve our patients and, help them achieve their goals.
I love that. Okay, one more question came in, psych, but I actually am really curious to hear your answer for this myself. Do you recommend any lash growth products?
Oh, yes, there are a lot of like peptide based one. And this is probably a whole nother webinar, but I'll just go over like Latisse. There's other peptide ones. Latisse does work great. There are some side effects with it, but there are actually now like these components that will grow your lashes. Yeah.
You do recommend Latisse?
Yes, Latisse is one of the and there's other peptide based ones, but Latisse is great for growing
Got it.
lashes and also eyebrows.
Yes. Yes. I know. I use it every night on my lashes and then a little on my brows. I agree. All right. Perfect. Well, maybe that is another idea for a whole webinar about our eyelashes, right?
Definitely,
Um,
yeah.
all right. Otherwise, thank you all so much for attending. I want to remind you that we have now looked at how many people are here and I've recorded your name. So the first 3 of you to book your treatments with Dr. Bowen will get 10% off, which is great because we don't really do discounts like blanket discounts like that on treatments, plus a complimentary skincare basket when you finish your treatment. So that is a really good offer. So I want to make sure we're not answering the phones anymore because it's after hours now, but you can I'll pop a link in here so you can book online directly with Dr. Bowen. and book your consultation. The sooner you get in to book your consultation, the sooner you can book your treatment and hopefully be one of those first 3. So I see that it looks like Dr. Boen has just a couple appointments left through the end of April. So I encourage you all to jump on and try and book those up now. And otherwise, thank you all so much for taking your time out of the end of your day to join us. I'm sure we all had busy days, whether you're a mom or not. And thank you, Dr. Boen, for taking time to do this with us today. We know you had a busy day seeing patients, and now you're home with your kids, and we appreciate you taking this time as well.
Yeah, no,
So
thank you so much for joining. Yeah, I truly love kind of educating and sharing this knowledge with y'all, and I hope you see you in clinic.
yeah, so please do come see us in clinic. Refer any of your friends or family or other moms because, us moms, I have young kids too. We all deserve to look and feel our best. And there are a lot of options. I see them every day in Dr. Bowen's patients. So please do. We hope to see you. And thank you so much. Bye, guys.